Welcome to today's medical podcast. I am your host, Dr. Sandeep Nagre. Today, we're going to explore a critical part of our body that many may overlook, the thyroid gland. We'll discuss the basics of the thyroid, its function, and the common disorders associated with it, hypothyroidism and hyperthyroidism. We'll also walk you through the steps of diagnosis and management. The thyroid gland is a small butterfly-shaped organ located in the lower front part of your neck, just below the Adam's apple. Despite its size, the thyroid plays a major role in regulating your metabolism, energy production, and overall bodily functions. It does this by producing two essential hormones, thyroxine, or T4, and triiodothyronine, or T3, which affect almost every cell in the body. The thyroid gland is part of the endocrine system and works closely with the pituitary gland. The pituitary sends thyroid-stimulating hormone, or TSH, to signal the thyroid to release T3 and T4 into the bloodstream. Let's start by talking about hypothyroidism, which occurs when the thyroid gland doesn't produce enough hormones. This condition slows down the body's metabolic processes and can lead to a variety of symptoms. Symptoms of hypothyroidism include fatigue, weight gain, cold intolerance, dry skin, constipation, depression, and menstrual irregularities. Left untreated, hypothyroidism can lead to more serious health issues, including heart disease, infertility, and in severe cases, a life-threatening condition called myxedema coma. The most common cause of hypothyroidism is Hashimoto's thyroiditis, inadequate iodine intake areas of the world. It is an autoimmune condition where the body attacks its own thyroid gland. Other causes include iodine deficiency, thyroid surgery, and certain medications. On the other end of the spectrum is hyperthyroidism, a condition where the thyroid gland produces too much hormone, speeding up your metabolism. Common symptoms of hypothyroidism include weight loss, rapid heartbeat or palpitations, nervousness, irritability, sweating, and tremors. Some patients may also experience heat intolerance, difficulty sleeping, and muscle weakness. Graves' disease is the most common cause of hypothyroidism. This is also an autoimmune condition where the immune system mistakenly attacks the thyroid, causing it to overproduce hormones. Other causes can include thyroid nodules and excessive iodine intake. How are thyroid disorders diagnosed? The first step is often recognizing the symptoms we've discussed. From there, doctors will run specific tests. Blood tests are the gold standard for diagnosing thyroid disorders. The most common test is measuring TSH levels. In hypothyroidism, TSH levels are typically high because the pituitary is trying to stimulate an underactive thyroid. In hyperthyroidism, TSH levels are usually low as the pituitary tries to stop an overactive thyroid from making too much hormone. Doctors will also measure free T4 and T3 hormone levels to confirm the diagnosis. In some cases, imaging tests like a thyroid ultrasound or radioactive iodine uptake scan may be used to evaluate the structure and function of the thyroid. In rare cases, central hypothyroidism is the cause, where you will need more endocrine workup. We will discuss more primary thyroid issues here. Let's talk about management of hypothyroidism. Hypothyroidism is generally managed with hormone replacement therapy. The most commonly prescribed medication is levothyroxine, a synthetic version of the T4 hormone. Patients will need regular blood tests to monitor TSH levels and adjust their dosage accordingly. Most people with hypothyroidism need to take this medication for life. It's essential for patients to follow their doctor's instructions on when and how to take their medication, as food and other drugs can interfere with absorption. Management of hyperthyroidism. Managing hyperthyroidism involves reducing the amount of thyroid hormone in the body. There are several treatment options, including antithyroid medications like methimazole or propylthuracil, which reduce hormone production. Another option is radioactive iodine therapy, which shrinks the thyroid gland. In some cases, surgery to remove part or all of the thyroid gland is necessary. It's important for patients with hypothyroidism to work closely with their healthcare team, as treatment may need to be adjusted over time, and some therapies can lead to hypothyroidism, requiring a shift to hormone replacement therapy. Both hypothyroidism and hyperthyroidism require long-term monitoring and management. Regular blood tests are crucial to ensure your treatment plan is working and that your hormone levels remain stable. Patients should also focus on maintaining a healthy lifestyle. Eating a balanced diet with adequate iodine can contribute to better thyroid health. If you have thyroid disease, discuss any supplements or dietary changes with your healthcare provider, as some can interfere with treatment. And that brings us to the end of today's episode on understanding the thyroid gland, hypothyroidism, and hyperthyroidism. Remember, if you experience any of the symptoms we discussed today, talk to your doctor. Early diagnosis and treatment are key to managing these conditions effectively. Thanks for tuning in. Please make sure to subscribe, share, and leave a review. Join us next time as we explore more topics to help you take control of your health.